I want to let you know June is National Cancer Survivors Awareness Month. So even though a child survived cancer, they still need to undergo annual exams to stay healthy. Here to talk about the reasons why this kind of monitoring is so important is Dr. Danielle Bello with C4K's Foundation. Thanks for joining us here on this Friday. You're the director of the long-term follow-up clinic, so let's talk specifically about that. Why is that long-term follow-up so essential?
Yeah, so a long-term follow-up care is really medical care designed for cancer survivors. And what many people don't know is that the treatments that are used to cure a child of cancer, so chemotherapy, radiation, surgery, they can have what are known as late effects. Now, these are similar to side effects, but they can happen years after treatment is done. So at C4K's, we really recommend annual screenings to monitor and manage these late effects.
Can you dig a little bit into what exactly kids might see, your patients might see when they're coming in for those follow-up appointments?
Yeah, so a patient will be seen by a number of specialists on the medical team. So it'll include the oncologist, a social worker, a neuropsychologist, a physical therapist, and an education specialist. And so really the focus is on a person's quality of life now that they've survived cancer and really monitoring those late effects. They'll also be presented with a book that looks sort of like this one, where it has their treatment history, all the details of what they went through, and then what are maybe some of the risks that they need to look out for in the future. So as an example, you may have a child that was treated for leukemia, which is a common cancer in childhood. And that may put them at risk later on for heart problems, weaker bones, learning problems. So this really helps them to know what do we need to monitor in the future, and for even as an adult, what their physicians need to look for.
Can I see that from you?
Yeah, absolutely.
So let's show this if we can. It's called Storybook here.
Yeah,
and
so
explain, what kind of stories are we talking about in here?
So the clinic is called the Storybook Homes Long-Term Follow-Up Clinic. That was a donor that we had to the clinic, the Storybook Homes Home Builders. And so our patients will get this treatment book where it talks about all of the different treatments they had.
If a childhood cancer survivor is not necessarily treated at C4K's Foundation, can they still access that long-term follow-up care?
Yeah, that's not a problem at all. So what we do is we'll just get their medical records from the center that they were treated at, we'll compile this book, and then we'll follow them every year.
It's so important, especially right now, June being National Cancer Survivors Awareness Month. Dr. Danielle Bello, thank you so much for joining us here.
Thanks so much.
On the CW. We appreciate it.